What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, March 6th, 2024. Today we're going to talk about multiple news stories. We're going to look at our daily data, such as Walgreens. We'll take a look at some wastewater sites today as well. We'll go over some national data, and we'll take a look at some state data. If you're new to my channel, this is where we do the daily pandemic update and talk about any illness that could be a threat to you. You might see the first news story is going to be about an alarming rate of flu-like illness in Ohio. We do cover stories like that, so if you want to keep yourself informed, safe, because let's face it, you probably clicked on here, or a lot of people often click on here because they know someone's sick, or they are sick, and they want to know what the heck is going on. So if you want to learn more, subscribe to my channel down below, give this a thumbs up, and of course share this with anyone you know. As the more people who find out about my channel, the more people we can help keep safe. Alright, starting off today. This is not good. Something really bad is happening in Ohio right now with illness. CDC reports alarming rate of flu-like illness in Ohio. We have to actually read the story. You know, oftentimes, if you've been on my channel for a while, following me, oftentimes we don't read stories. In this case, it's not a terribly busy news day, but this is worth us actually reading. According to the Centers for Disease Control's weekly report, Ohio is currently experiencing a high level of respiratory illness cases. These cases are associated with symptoms such as fever, cough, and sore throat, which are indicative of flu-like illnesses. Ohio is currently leading the nation in doctor visits for flu-like symptoms, making it a cause of concern for the healthcare industry. The latest data shows that there have been 726 confirmed influenza hospitalizations in Ohio for the week ending in February 24th. Wow, that's a really high number. In fact, could that be higher than their COVID number right now? Yeah, that's not good. Anywho, continuing on. So, that's the week ending on February 24th. This is making a nearly 15% rise from the previous week's 631 cases. Furthermore, physicians' visits for flu-like symptoms increased by 6% from the previous week. We have to read on even more. The Ohio Department of Health has reported that the state witnessed a 15% surge in flu-related hospitalizations in the most recent week. Approximately 8% of outpatient visits in Ohio were due to flu-like symptoms, as reported by the Ohio Department of Health. This data indicates that the situation is quite serious and requires immediate attention from healthcare authorities. Let's skip over some news for a second and take a further look at Ohio. And you can see here, they're in this maroon shade. The only higher shade is purple. We'll have to see if Ohio goes up to purple on this week's update. So yes, very high levels there. Their neighbors to the north, Michigan, also very high. High levels in Indiana, but I must stress they're just about one step away from moderate. And Pennsylvania is still moderate at this time. West Virginia at this time is in the moderate stage, and Kentucky to their south is also high at this time. So concerns going on in Ohio. Going on to our next story now. I have to share some good news from time to time, and this is good news. Well, for now it is. It's kind of a warning. No measles outbreaks reported in Hawaii, despite rise in cases in the U.S. It's spring break season. With spring break season, a lot of people are going to be traveling around the United States. What am I getting at here? Why am I showing you that Hawaii has no cases? Well, that is because of the fact that with spring break, a lot of people are going to be going to different places, such as Hawaii, Florida. We already know cases are a big problem in Florida, and there'll be some other places, maybe South Carolina, maybe the Gulf Coast, maybe someone's going to go out to California. I don't know. But with spring break, I expect there's going to be more cases. Wouldn't surprise me if Hawaii reports its first case relatively soon. As we know, there are 41 cases reported among several states: Arizona, California, Florida, Georgia, Indiana, Louisiana, Maryland, Michigan, Minnesota, Missouri, New Jersey, New York City, Ohio, Pennsylvania, Virginia, and Washington all currently have had measles cases this year. All right, moving on. We have to talk about this. A Georgia shelter in quarantine. Urgent call for community support amid illness outbreak. This is not the first time we've seen an animal shelter dealing with an outbreak, and they are asking for help from the community, donations of sheets, towels, blankets, unused dog or cat toys, bleach, and laundry detergent. And this is down in Georgia. I will tweet this story out. Maybe if you want to learn more about it, or maybe you want to help the shelter, I'll tweet it out. All right, Norway. Yes, that's right. We go international too. Norway. People who have had COVID-19 have a poor memory. Just reading the headline here. It's not a good headline. It's a study. We'll be adding this study to our website. We'll be adding it to COVID's effect on the brain. All right, moving on to this now. I wanted to discuss this because I'm really concerned here. You've seen me talk about the Pope a couple times in the past. Well, actually, no, several times now. Let's see, how many times have we actually talked about the Pope? Let me explain. Pope still recovering from illness. Now, I have to click on this story here because it makes us a little bit confused. Let me explain why. It says here, Pope Francis urged prideful people to recall one of Jesus' moral commandments to never judge. Okay, but it does say here, and I have to pull up where it actually says it here, and it does say here, Pope Francis coughs while making brief remarks at the end of his weekly general audience in St. Peter's Square at the Vatican on March 6, 2024, after having an aide read his text because of persisting cold symptoms. So wait, it's a cold now? If you recall, Pope Francis, just about a week ago, or two, did have flu. He had influenza. Okay, but when we come down here, it now says, still recovering from illness. Pope Francis told visitors an aide would read his talk because he could not read well due to a cold. Yikes, that's not good. And what's also not good is, I had to do some searching this morning on my Twitter page, at COVID Data Report. I wanted to see how many times since I started my Twitter page, which I believe was back in 2022, or no, late 2021, how many times did I mention Pope Francis? Yeah, I've mentioned him quite a few times, and I actually did some screenshots here. If we go back and take a look at some of them, we can see here, just 6 days ago. Okay, so it was only 6 days ago he had the flu. Now he still has cold-like symptoms. He was in the hospital for the flu. November 2023, Pope Francis was forced to cancel a public appearance on Saturday due to a mild case of the flu. Then we go back to March 2023. I did that update that day, and it says Pope Francis was hospitalized. Let's continue on. In March 2023, Pope Francis was hospitalized with a lung infection after experiencing difficulty breathing in recent days. Then in June 1st of 2023, apparently he had a fever. He resumed his schedule. We never did find out when he started having that, and I put there, pretty sure I missed the update to this. Pope Francis had to resume his normal schedule after having a fever. All right, moving on now to air quality values. We hope the Pope does get better. God bless the Pope. All right, taking a look here at air quality values. The usual places, the fires, they continue in Texas. Eventually, I'm going to do something on my other channel about the fires and just a weather update in general. But you can see here, poor air quality values there. Anytime the wind is blowing from that area, say from southwest to northeast, you're going to see some of this smoke make its way into Ohio, Tennessee, Indiana, or anywhere else in its path. The Mid-Atlantic today, I don't know why there is some poor air quality here. We are having rain today. I'm looking at my weather station. Yep, it's still raining outside. We've had a quarter of an inch of rain here so far. Yeah, it's been a wet time. And the rest of the country, not doing too bad, aside from California. Look at this. It is still fireplace season, and there are still some bad air qualities there because of that. Taking a look now at the EMS incidents in Philadelphia yesterday. 747 were reported. This is a pretty decent-sized decrease from the account from Monday, so that is good to see. Let's do a live look-in at the Philadelphia suburbs. We see, wow, currently 16 calls in Montgomery County right now. Let's take a look at some of them. Respiratory emergency, stroke, cardiac emergency, another cardiac emergency. So yes, there are some calls being had there. Ooh, nausea and vomiting as well. How about Chester County, Pennsylvania? Wow, busy in Chester County, Pennsylvania. Let me make sure this is up to date. Yeah, it is. And I'm seeing not one, not two, but 3 sick person calls. And remember, we've been seeing quite a few sick person calls there lately. Heart problems, that seems to be something that's happening a lot. Respiratory difficulty. Been seeing a lot of them lately. Yeah, people who just had COVID over the winter. Maybe they're continuously getting sick. Maybe they're now having breathing difficulty. Hey, I had breathing difficulty post-COVID in 2020, and now I take Xolair. I just had my fourth round of injections today, on the left arm and on the right arm. I have my injections, and guess what? They do help my breathing. I think my breathing sounds better when I do these updates. Well, unless we're doing a morning update, sometimes we run into problems. All right, moving on here. Taking a look at Walgreens. We're just going to do a couple states on Walgreens. Nationally, 13.9% positivity, and this is for COVID. Not flu, but COVID. I think they also have a flu tracker as well. We don't generally look at it. Maybe it's something we could start looking at on here. I don't know. It's pretty late in the flu season, but as you saw, Ohio is getting bad again. Current week positivity is 13.9%. Prior week is 17.4%. Difference of down 3.5%. Total tests, 2,595. Prior week was 3,071. There's a lot of states not reporting, so that's not a good thing. But we must take a look at Ohio here, because we must wonder just what is going on with Ohio. Ohio is going up for flu and COVID. Look at this, 14.3% positivity this week. Prior week was 9.6%, up 4.7%. Okay, 63 tests versus 73. They're not doing a lot of testing, but you gotta wonder, could their COVID levels actually be rising? Because everything else there is rising at this time. Texas this week, 14% positivity. It was 18.6 the prior week. It's down 4.7%. Total testing down big time. 487 versus 639. Then we come up here to see Nebraska. 20% positivity. Why is it up so much? Well, they did not report last week, so instantly they have an automatic increase. California, 15% this week, 14.3% last week, up 0.7%. California has millions of people. Only 20 tests versus 21. Let's take a look now what's going on in Colorado. 6.3% this week, 24% last week. A significant decrease by 17.8%. And testing's up, 32 versus 25, so all things are looking good there. And let's do one more state. Georgia, 17% positivity this week, 25% last week. Difference of down 8%. Total test, 88 versus 120. All right, let's take a look at the CDC wastewater site. And if you're new here, I must explain. There are several different colors. Red's really bad, and the best color would be this dark shade of blue, with orange being moderate. And in between colors, you do have some other shades of blue. This light shade of blue is, we would say that's moderate. So taking a look here, you can see here, hang on, you can see that on the East Coast is where we have the most amount of red and orange sites, where there still are some high levels of COVID at this time. We can take a look at Hampton City, Newport, and take a look at this. You can see it's actually trending up at this wastewater site again. That's not good to see. 118,497 population. Again, this is for COVID. Let's take a look at Dallas area. And a lot of these wastewater sites on the CDC site there do not update frequently. Taking a look down near Houston. Look at this. A lot of these sites are finally now dropping. Let's zoom in. Still some red sites. Montgomery County, Texas, that's dropping. Harris, here's one. Smaller site, but it is rising at this time. But we can take things a step further. We can go to Wastewater Scan, and we can actually take a look, get this, at other viruses. That's right. If you're new to my channel, we can look at other viruses as well. And let's look at what's going on in Middlebury, Massachusetts. So we see for Middlebury, Massachusetts, they still report COVID as high, but it's dropped significantly, and I don't think that has updated yet. That should probably not say high anymore. Maybe moderate to low at this point. RSV, it was dropping. It was dropping end of January. Now it's just leveled itself off in February coming into March. Influenza A is rising. Influenza B is starting to rise again. HMPV is rising. Norovirus, wow. Look at these norovirus levels here. What is the population? 250,000 population. You know, it's near Marlborough, it's near Worcester, Shrewsbury's not far by. This is just west of the Boston area. And again, wow, that is one of the highest and fastest norovirus rises we have seen since we started showing the wastewater scan site. I knew it was going up in the Northeast. Wow, this site is just super concerning. Mpox, there is a detection on February 22nd. I don't know if that's legitimate or not. There's been an issue with that on this site as of lately. On this website, not this particular wastewater site. They've had a glitch where they'll show a positive Mpox case at every wastewater site. Don't know why that keeps happening. February 25th, there was a detection of hepatitis A. All right, let's take a look somewhere else now. Ooh, that norovirus level. That is super, super concerning. How about South Carolina? Let's go to the Greenville area. Can't do that at this time. Let's see. Sometimes this particular wastewater site does not always come up. No, we're clicking on it and it's going back to national. Let's try again. Nope. For some reason, Greenville will never want to load. Let's take a look at the northern portion of Atlanta. Big Creek, Roswell, Georgia. I actually know some people that live down there, relatives. Anywho, let's see what their COVID level is at. COVID for 189,593 population. We can see here that COVID, it's still listed as high, but it is slowly coming down. RSV, not much of an issue at this time. That's actually really good to see. Influenza A, it is rising ever so slightly. Influenza B, the overall trajectory was downward. Then it started to go back up, and that most recent updates dropped a little bit. Norovirus, not much of an issue yet, but it is in the high category, so a little concerning. And yes, it looks like we are having, once again today, that Mpox issue that we've been seeing lately. Let's just do one more wastewater site, because I just realized we're already 16 minutes into this video, and we have a lot more data to take a look at. Let's come out to California. Can we do anything in the Fresno area? No, we cannot. Let's come down here to... How about we go up to San Francisco, shall we? Let's just do it. Let's see what's going on. How about the Oceanside wastewater site here? We look at this one quite frequently. We can see 250,000 population, medium for COVID, medium for RSV. Not rising at this time. Influenza A is not rising. Influenza B, whoa, that's really starting to rise now, so that's something we'll have to watch. HMPV, rising a little bit. Norovirus, not much of an issue at that. It's coming in high, but we're not seeing it rise yet. So that is good to see, and there have been some hepatitis A detections at this time. Taking a look at other wastewater data, Southeast has the highest levels at this time. Taking a look at hospitalization data in the United States, we can see 76.6% of all hospital beds are currently in use, 2.3% for COVID, 1.1% for influenza, and in the ICU situation, it's 72.3%, 2.2% for COVID, 1.3% for influenza at this time. Taking a look at COVID deaths, they're down 8.7% in the past week. The only place that they're really rising a lot right now would be the state of Maine. Hospitalizations, 17,310. That's down by 10.3%. Influenza status is growing in many states. As you know, we talked about it. Ohio, it's growing. And look at this. It's actually growing pretty quickly in some other places right now, such as Idaho, South Dakota, Nebraska, Iowa, and Missouri, where these purples are. These other places that are in lighter shade is likely growing, such as West Virginia, North Carolina, and Arkansas, Illinois, and believe it or not, Ohio is in the likely growing stage. I don't know why they're not in the growing stage, but you think they would be. And look at this, likely growing in Connecticut, Rhode Island, and also in Washington. All right, moving on now. JN.1, 92.3%. And then the two variants that we're starting to watch come up to see if they can outdo JN.1 would be JN.1.13, which is at 3.3%, and then JN1.18 at 1.8%. All right, taking a look now at New Jersey. 92 people have been discharged in the past 24 hours. 70 out of 70 hospitals reporting. But take a look at this. Here's the hospitalizations. Here's the problem. You can see here, they were dropping pretty good through much of February. Then the second half of February came and, well, that slowed down. And then it went to a grinding halt at the end of February. Actually rose a little bit. Now they're not really dropping all that much. In fact, over yesterday, that's up by 3 with that 547 number. 72 people in the ICU, 26 people on a ventilator. So yeah, you can see here, 70 out of 70 hospitals reporting. Not a big drop in New Jersey at this time. New York State, fantastic news today. Only 675 cases reported. Obviously, that number would be higher, but look at this. The hospitalizations, they have come down to 941. That's right. They're now below 1,000. Yesterday was the first day below 1,000. They had 999 yesterday, 117 in the ICU. Today it's 941, 113 people in the ICU. Alrighty, folks, that does it for today's pandemic update. we'll have our next edition of the Pandemic Update again tomorrow. A reminder that probably the next 2 days, maybe even Saturday as well, the Pandemic Update will be in the morning. It'll come out in the morning. Now, you may see it at various different times of the day, but look for it. Look for that notification bell, or if you have notifications on your phone, that's how you receive them. Look for a notification to come across at some point in the morning hours versus the afternoon hours for the Pandemic Update. If you enjoyed this update, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below, and of course, share this with anyone you know. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.